Throughout my career, I have over 1,500 clients get out of chronic lower back pain without stretching, core work, or chiropractic care. Now, as you can imagine, more than 60% of my clients have anterior pelvic tilt as well. So in this video, I'm going to share everything that I know about anterior pelvic tilt and walk you through how we help our client Joe not only get out of anterior pelvic tilt presentation, but also get out of his chronic lower back pain within just 10 weeks as well. Now, first thing first, anterior pelvic tilt is not necessarily a bad thing, okay? A lot of great athletes on the planet Earth, they have anterior pelvic tilt. So think about LeBron James, think about Cristiano Ronaldo. All the great athletes on the planet Earth, they all perform at the highest level and they feel absolutely nothing. Now, if anterior pelvic tilt is not necessarily bad, the question is, what is yours causing you so much pain? And that is what I want to talk about today, okay? So anterior pelvic tilt, it just happened because of one reason, for your body to move forward as well. Now, as human beings, we are trying to do three main things: survive, reproduce, and we need to move forward in space. So our body will have the tendency to move our center line of mass forward by arching our lower back as well. So we can use less and less energy to actually move. Now, again, like I said before, this is not bad in nature, but if you get stuck in this anterior pelvic tilt presentation over a long period of time, because maybe you're sitting at your desk all day, you don't do any recovery work, and your body gets stuck, you can't seem to get out of it, this is where the pain will shows up. Now, every step you take, every time you sit, every time you stand, every time you train your body, you're loading your spine unevenly every single day, and a lot of time unconsciously too. So at the end of the day, this is not a anterior pelvic tilt problem. This is where, you're stuck in anterior pelvic tilt problem. So the fix is super simple. Bring your center line of gravity back so your body don't have to move into anterior pelvic tilt in the first place. Now, I know a lot of people may say, sure, Alvin, I just stretch it. I just, keep decompressing my spine and I'll probably will be fine. Now, if you want to go ahead with your time, by all means, sometimes, we just have to learn the hard way. I learned the hard way too. But the thing is, now that's a backward thinking. As a professional, I don't want you to decompress or stretch out anything. I want you to have a neutral spine, meaning your head, rib cage, pelvis stack on top of each other. You move correctly, you can use your muscle effectively, you can produce force effectively, so your body won't even feel weak, feel stiff, feel tight, feel pain in the first place. And that's what we want. That way, not only we can get you out of your lower back pain, but also you can get back to sport that you actually love. Now, I'm gonna give you the 4-step we use to help our client Joe get out of his anterior pelvic tilt and the lower back pain. Now, huge shout out to Jeff, Joe's trainer. If you're watching this video, Jeff, you're absolutely awesome. Now, here's a little bit background on Joe. So his pain level was around 6 out of 10. Have this lower back pain for about 5+ years. Try physiotherapy, chiropractor, massage therapy, multiple years. Active gym goer, super fit, super strong. He got a pretty overly active hip flexor as well. So step number 1 will be nervous system reset. We did 3 main things. So supported chest pose breathing. We did a 90-90 hip lift, and we did a pronation drill. So the first exercise is to open up some space within his lower back region. The 90-90 exercise is to help him control his pelvic position better. And because he got a lot of ankle problem and also he got duck feet, so we did a foot specific drill too, so his body can actually adapt it better. Now, if your nervous system is still running that protection program, it doesn't matter what kind of exercise you do, your body just won't adapt to a long-term period. You have to teach your nervous system that movement is safe again before you can do anything else. Otherwise, nothing will stick around. Now, step number 2 is asymmetrical training. So we added right side and left glute med with TFL inhibition because he got a lot of TFL in the hip flexor problem. We also added adductor and pullback only on the left side, and also 90-90 half row only on the left side as well. His left side and right side are not the same. Now, his left pelvis got way less internal rotation compared to his right side, so he doesn't get to do the same exercise on both sides of his body. Now, this is actually how he and how you can actually get out of this stuck position. Now, by training both sides exactly the same, but finding exactly what that asymmetry, what that imbalance is, and you want to fix it accordingly. Now, number 3 will be loading. So we added knee wall reference RDL, B's and glute ridges, and we did a couple core exercise too at the very end. Now, once your nervous system is calm, your movement is now more balanced, and now you can train. Now you can build strength, but you have to earn it first. Most people jump right into strength training and wonder why, their half flare up every single time when they push their body too hard. Now, step number 4 will be body mastery. Now, this is about understanding your own body. So when something came up, let's say 3 years from now, you know exactly what to do and also what not to do.
Before I reached you guys, Jeff, I was literally at a point where I could barely walk. Wow. My hip flexors were so tight. My lower back was so stiff. The side of my hips hurt to the touch. Like my piriformis, my psoas, my glutes, everything was just on fire and completely locked up. And yesterday I woke up, put my feet on the ground, and normally I could barely stand up straight. I had like very little pain. And I was like, wow, this is the first time I felt like this in years. Went to the gym yesterday, did some of the weightlifting exercises, got up this morning and was like afraid to get out of bed. But when I put my feet on the ground, I was like, holy shit, this is 2 days in a row. Feel pretty good.
I told people in my companies all the time, the goal for you is to never need us again. And that's the goal. So here is what I want you to take away from this. If you have anterior pelvic tilt and you don't have any pain, don't worry too much about it. You don't have to fix it. And don't let anybody tell you otherwise. But if you have anterior pelvic tilt and you're in pain, the tilt itself is not the problem. Being stuck in the anterior pelvic tilt is the problem. And the way to get out of it is not more stretching, it's resetting your nervous system, rebalance your movement pattern, and then doing with the right sequence and the right amount. Joe actually hit multiple plateaus because his hip flexors and glute are so tight, but we end up solving them 6 weeks later. So it is really important to train with a plan and direction in mind. Now, if you like this video, you can share it to somebody who also want to hear it. And if you want to go deeper on exactly how this method works, I can link that free training link down below as well. All right, see you guys in the next one. Peace.